On that note of handbook, the last piece is with me. This is all great, transcribed, it's very good. It's the history part, which I'm like really truncating.
You were involved
So,
at Sac County?
once that's done,
Yeah.
and then my other way has
How long
already
have you
made
been in
all of the other
Humboldt?
pieces ADA
Oh, been 9
compliant,
years
is poised to do, PDF
next
posting
Oh, okay.
online.
Yeah,
But it'll
retired
look
9
real
years ago.
different.
And you
with
made your
different
way up here.
Stuff in there, right?
Yeah,
So
actually, I
Makes sense.
I
retired
think
on
that maybe at the
August
exec meeting, it'll take.
Oh, you're
2015.
coming up on
Do
your
it.
And I came here on August 28th.
Maybe I was
I mean,
that.
you know, we did,
Yeah.
Here's
you know, it was a
You
planned
know.
retirement.
And we're
Yeah.
like, we're saying.
I was gonna say, on
it's
days like this,
CBHD,
it
not
probably
CBHD,
feels good to be here and not
No,
there.
But you know,
The
yeah,
heat was one of the most major factors, the
Yeah.
traffic, you know.
I know.
But hopefully.
It's a
it's our
beautiful
next
city,
step.
though.
We don't have one.
Yeah, it was a
fun.
great place to raise our children, I can't.
Oh, I bet you had all the
Sure have
resources
it
for
there.
them.
Yeah.
and-
Before.
Good schools.
Then-
Yeah, totally.
Yeah, it'd be great.
And then I couldn't make her bed.
And then we'll still, we'll still have it.
And what
I couldn't work here. I couldn't work
Yeah.
next door to that.
Being close to all the
I'd be over there.
action
Yeah.
too, it's probably nice.
Yeah,
in
like,
that scenario.
you know, I didn't have to travel for
Yeah.
CalPAC meetings and stuff.
I know,
What's that?
we were just talking about that. Yeah, cause for us, if we travel to meetings like that, it's a whole, you know, a whole ordeal to get down there and back for
So
like a
at this
2-hour
point,
meeting.
it's like.
I'm good with
Well,
that.
and you know what's weird is, a year before I retired,
I like to share
this airport here had direct flights to Sacramento.
We work it well together.
And then, of course,
Yes.
when I got here, then it was gone.
Yeah, we're co-doing a
So
lot
now
of
whenever we
things.
want to see our son, who
Perfect.
still lives there, we
It's a
drive for
big
6.5 hours, yeah.
Yeah, totally. I know, that's the problem about Humboldt, it's hard to get in and out of, but it's
Yeah.
nice to be here.
Yeah. But maybe it kind of keeps it special
I
too.
know, right? Yeah, if we opened up the airlines a little more, maybe that wouldn't be as nice.
It's weird to think that way back early in the last century, there was a train that went from San Francisco up here several times every day. Isn't that weird to think about?
That is,
Be kind of
That would be
nice
cool.
now.
I would love to let someone just take me instead of having to do the drive myself. Yeah. I thought
A few books where I was gonna mention.
Hi, hello, how are you?
Running on empty, but good.
Oh,
And I did.
I got my fix.
my husband put this in the very back of our refrigerator, but I
Yeah, I
still
was
look
in
today.
Oh,
Evidently super caffeinated.
you think I'm crazy enough without having a lot of caffeine, so. Imagine if I drink Starbucks and my friends are like, oh, no, you're one of those dudes.
I drink Starbucks as well.
Yeah, it's just not a good.
Yeah.
A good thing.
Alrighty, it is 12:16, and I'm calling this meeting of the Behavioral Health Board to order. We are the advisory board for the Board of Supervisors. We hold this meeting on the fourth Thursday of each month. It runs from 12:15 and can go until 2:15, but often doesn't. We meet in person at 507 F Street in Eureka. This is a public meeting. Minutes and agenda can be found by internet searching Humboldt County Behavioral Health Board. We provide time for public comments early in the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to the Behavioral Health Board. When we ask you to make those comments in a respectful manner, please note this meeting is being recorded. And with that, I will ask for the roll call.
John Berger,
Present over Zoom.
Marguerite Story Baker,
Here,
Bob Doherty.
Here.
Raphael DiCaprio. Kristen Sumner, excuse, Laura Montana,
Here.
Natalie Arroyo, Virginia Bass.
Here.
Tim Rhodey. Debbie Hartry,
Here.
Annette Kellerman,
Definitely here.
Bryce, excuse, Oscar McGowan, Catherine Smith.
Raphael.
All right, Rafa. Natalie Arroyo did say she'd be here, but she wasn't there late. Are there any adjustments to the agenda? Hearing none, we will, let's see. Introductions. Oh, sorry, I didn't do introductions of people in the room and people on Zoom. Do you want to introduce yourself? Sure.
Yeah, I'm Haley Emery. I'm the Deputy Branch Director for Children's Behavioral Health.
Yay.
And I think I'm the only one from our admin team here today. It's kind of funny.
That's right, yeah.
Hi, Christine Messenger, DHHS. Laurel Johnson, DHHS admin, and
Anybody online that would like to introduce themselves who's not a board member? I see a couple people.
Hi, Sharon Wolf, Legislative Analyst with DHHS. Good to see you.
Thanks.
I would like to also introduce myself.
Yes, please.
Hello, everyone. My name is Manuel Fletes Medina. I form part of the CalBHBC staff. That's the California Association of Local Behavioral Health Boards and Commissions. We are a board to support the local county boards. So if you have any questions, comments, or concerns, you can visit calbhbc.org to find resources and where you can contact us. Thank you.
Thank you, Manuel. Welcome. All right.
What about Eric?
Oh,
Eric Thompson, just a guest. I was on the board for quite a while and I'm really interested in some of the topics that we covered and got a couple things to say today.
very good. With that, we'll go to public comments. Eric.
In the last couple months, I've tried to figure out a way to make suggestions about what I call an outreach program where ideally members of the staff at mental health or behavioral health can go particularly down to Old Town and help people with their needs as far as getting them services, some type of services. And it's very, I spent about a week down in Old Town kind of checking out the situation. And frankly, I'm kind of appalled at how there are so few services that are reaching that community of homeless, mentally ill people. And this is a nationwide catastrophe, basically, as far as something that seems like it could bring down this country with no attention to. There's such a huge population out there that doesn't even know about mental health or behavioral health, doesn't have access to services. I found a good friend of mine that used to live with me down in Old Town, sprawled out on his back, hung out on fentanyl, and it just appalled me. I thought to myself, like, God, this guy's gotta get help. And I would just think it'd be great if we could have like a team of people that would go out, particularly to Old Town, because that's where the problem is most acute, and introduce themselves to the population down there over here, and make connections in that community. Now, I understand there are some groups that are working on homeless issues, primarily to get them housing, but that's, as we know, only the start of what's what needs to be done for them, particularly mental health and alcohol and other drugs problem. And it would just be great if we could set up a program where people would go downtown and just introduce them, so that hopefully if they want to visit a card or they want an appointment and behavioral health, get them motivated for it. We can call it like the homeless or houseless empowerment or encouragement.
That's 3 minutes, Eric.
Okay.
Thank you
that's
so
all
much.
right.
Appreciate that.
Yeah.
Any other public comments? All right. Perfect timing. We have Supervisor Arroyo here. We can approve the minutes from the 6:27 meeting if anyone wants to make a motion.
I make a motion that we approve the minutes as they are written.
Second. All in favor, say aye.
Aye.
Opposed? Thank you very much. Those minutes are approved. It is now communication time, which is where board members can communicate any of the latest and greatest that they want to. And I'll start with, we had a fabulous service fair barbecue yesterday in front of the free meal. The partners that were there were amazing. We had everyone. We had, I think, 3 or 4 DHHS booths. We had Waterfront, Crossroads. We had just like 33 booths there. And we had, which was especially amazing, was there's CIT, which is Crisis Intervention Training, which is a 40-hour training put on in this county now twice a year. And this coincided so lovely that that whole group of 36 people came to the service fair barbecue. And so it was just a great way for everyone to meet each other. People that say, I've talked to you on the phone for years, I never knew what you looked like. Just the connections were incredible. So I'm pretty happy about that. Alan was there, Debbie was there, oh, you weren't there, were you? You were there.
I was around.
Yeah. So it was quite lovely.
Doing stuff and things.
Yep. That's my report. Thanks everyone who was there. Ma'am?
I have nothing to report. I'm just glad to be here. My new job is settling down a little bit better. Good, we're glad to, and I actually have friends there now that will take my shifts occasionally. So
There we go. Making friends.
Making friends. So I can be here more with you. Thank you.
So my name is Danette Kellerman and I am a board member, a social worker for Conflict Council. I'm the chair for Recovery Happens in Humboldt. I know, I'm always excited about this, Laura. We are, we're into our last month and a half and it's getting really exciting. And so hopefully we can have a great event this year. It's September 7th at Sequoia Park. Also, Raphael, I think I'll let you talk about the other thing. But just, I went to the event yesterday and I was one of those people that's been talking to people. This one lady, well, I talk to everybody, but this one lady especially, like I call her at least twice a week for something and we never seen each other's faces. And it was really kind of cool because I was like, oh my God, I can put a face to a name. And so, yeah, she just, we work in a small community and sometimes we never meet each other. But people hear, I'm sure people hear my name, people hear Laura's name. So, it's awesome to have events like that where people can see faces. And what really made sense to me yesterday is it's overwhelming to me when I see actual, like a lot of our clients, no one ever looks at them in the eyes. And people act as if they're contagious or something sometimes. Just from my perception, I grew up with a sister that was, back then it was socially acceptable, say mentally retarded. And people always treated her like she was contagious. And I see some similarities of that going on in the community. And so yesterday it was cool being able to see, like, people actually felt like they were seen and heard. And it was a beautiful thing. And so, I'm just really grateful. You know, there was a lot of information, that was handed out for people that wanted to pick it up. And so, I appreciate all the hard work you did, Laura. Thank you.
Can I ask what time it starts on September 7th?
There's flyers right over there. I can grab one, during break. Just kidding. During break. It's September 7th. It starts at 12.
12.
And,
Awesome.
and this is, Raphael's. Yes,
Marguerite, did you have any communication?
Yes, just very briefly, in my constant quest to get to know more providers, it was my intention this month, but I haven't been able to get a hold of her, to get a hold of the woman who started the recovery program. Is it in Garberville or Fortuna, the newer Redwood?
It is at, Gerald Phelps. I was gonna ask if we can actually have her come introduce herself our next meeting. I didn't know if there's a schedule, because I guess now I'm the chair for substance abuse also. So I'd like to, have some people, that, are doing programs, either clients or staff, come out and, introduce themselves to our committee. But I didn't know if there was already a schedule made up, but I'd like to, start introducing our communities. And her name is Carrie Cesario.
Carrie, right, so it's my intention to go see, set up a time with her in September. And I guess I'll let Joe know when that is once I do it, so if anybody else on the board would like to join me when we go, it would be a good thing. To my knowledge, she's the newest substance use program person in our area now, and a little bit further away from Eureka Central, so. Oh, thank you, that's a good thing. And so it's Carrie Cesario, and she's in Garberville, yeah, so now.
Yep. It's exciting.
And I plan to, and I'll get a hold of him, I plan to sit at the table that Vern has, at least the early part of recovery happens at the board table. So I'll be there to help represent the board. I can't stay the whole time, so I have to be in Sacramento for a meeting the next morning, so I gotta get out of here by 2 or so, but I will be there from 12 to 2.
Thank you.
Bob, do you have any communication?
I do. Hi, everybody. United Indian Health Service is gonna have a summit, next month, the 21st, 22nd at College of the Redwoods. They're looking for presenters and for people who wanna do workshops. Right now, it's open. You got a pretty open schedule for that. You can get a hold of me or Alexandra at UIHS to get the registration form for that. The nation's finest is going to be there, have a table. And months ago, I approached the cultural committee to be able to do some drumming and some cultural events like that. And after about 3 months, they got back to me and welcomed that, approved that. So I can start doing some of those activities in the community here with their approval. And I'm actually going to be doing a workshop and a presentation at that summit on drumming. There's a number of events coming up in the Native community. We got is also having an event next month. There's not a lot of information on that yet. And there's some activity out in Koopa. So lots of things going on.
Thank you. Bob, do you have a phone number that we can reach out to you to? I'm sorry.
Joe did send out the list. with
Okay,
everybody's-
never mind.
Hi, well, I sat in on some of the CIT training on Monday, which was really great. Some of the sessions that I hadn't heard before, I hadn't heard from those presenters. Our public health officer, Candy Stockton, did an amazing presentation on substance use disorder and the impact of different substances on the body. And I thought it was really, really good, really well done. And let's see, I also attended the fair yesterday for just a portion of it, but I helped Vernon with tabling so he could have a chance to walk around and enjoy the event. And it was interesting to see the dynamic of when he got up and left, who came over to talk to me. Just, different people, different like responses from folks. Gave out some information about this board meeting to a few people who had an interest in participating online or coming in person, and then certainly all the resource lists that were available. We were talking about, and I think he'll share some more thoughts about this at the next meeting when he's able to be here. He's giving a talk to the crisis intervention teams panel today, so he's participating in that today, which is why he can't be here. About his lived experiences, which I think is incredibly valuable. But we were talking about jazzing up the table a little bit, because it is all like handouts that are just, it's like resource lists, and it's great information, maybe a little bit of visualization of fun things that we could do around the outreach. And yeah, but I think it was fun to be there, and it was a really nice event. Got an ice cream cone. Just really had a nice time, like chatting with the people who are participating and who are, they're receiving services and information. And yeah, it was a good one. So I was just glad to get a chance to see it all happen. Beyond that, I don't think I have any other updates right this moment.
Just another attendee and participant yesterday at Free Meal, and NAMI Humboldt we had a table. Our table was pretty cool.
Yeah, I looked at it and I was like, oh, they've got a bunch of cool stuff. I felt jealous.
Well, I'm the one who's kind of gotten all that stuff organized over the years, but anyway, I'm really happy with it now. But it was constant talking to people. I was there half a day, and the morning people who I replaced said they were talking to all the CIT people, which was really great. Yeah, so talk to just every group of people there when I was there yesterday, and I really relate to what you're saying, Jenna, because I know I talked to a lot of people with issues, people with mental illness, people with substance issues, several people. And I was thinking about how when you're out there like that, like we are now, sitting there with all the info and smiling people and so forth, people feel safe talking to us. It doesn't, and it happens with anybody who's table. It's not just us, but it's just kind of interesting how people trust you and they tell you stuff, and it's really powerful. And the other thing that I wanted to say about tabling was we got this one person who works at Arcata House came by. He told us, we were talking a bit, but he told us how much he had gotten out of the CIT presentations that in some year previously, with the ones with people with lived experience, which would be the one Vernon's on today, and then we had parents later in the afternoon. Well, not all parents, but family members. My husband, for one, he's over there. So, and he's done it for years and years. But anyway, it was nice because this Arcata House staff person said that he really got a lot out of those panels, you know. And you hope, you hope people are getting something out of whatever you're doing, and it's just nice to hear it from a person. So I enjoyed that. The other thing I want to remind people, I think I've talked about our family class before and sent out flyers, but it's coming. We only do it once a year. It's 8 sessions. It's for family members. And people get a lot. Sometimes it's people's first contact with other people who are dealing with what they're dealing with. So anyway, I recommend if you have any place to post one, I put some over there. And yeah, so there's that. And then one other thing was last meeting, Tim Doty mentioned reading books, which reminded me, there are a lot of good books about mental health and stuff. And so that reminded me that I had some books sitting around gathering dust that I've already read. So I brought some of them. And I don't know how much to say about them. I'll just say about this one, it's new. It's called American Madness. It's written by a psychiatrist who lives in Berkeley, who I've met actually, just because we have mutual friends. But anyway, it's good. And she's talking about her own personal experiences in the Bay Area working for, and she's worked for some different agencies. This is from our, I don't want to go on too long. How am I doing?
People can look at those.
Yeah, you can look at the books. Look at the books. This one is Betty Chin's book, if you haven't read it. And
Can we sign up for that?
I mean, it's really intense, really. But it just gives you this appreciation for her, who many of us know because of her program that she runs. So anyway, thank you. That's me.
Going to board members, Sean, Ralph, do you want to say anything on communication?
Afternoon, everyone. I was just gonna mention about the block party, but a lot of it has already been said, and it was just so nice to see a lot of the barriers, breaking down and people having conversations, both, at the booths and in the surrounding areas. So yesterday was just a glorious event, and just wanted to add that 2 cents.
Hi, everybody. Yeah, just to piggyback, yesterday was a great success. I think I passed out probably over 500 business cards. I just sent a message to my core leader that we need to order more business cards, which is awesome. Yeah, so any updates? Let's see. We are planning the Humboldt County's first International Overdose Awareness Day. So August 31st is International Overdose Awareness Day all over the globe. We have formed a small committee here, and we are going to be participating in this global event. Providence has agreed to light up the buildings purple that night, which is a very big thing. It's awesome. Landmarks and hospitals and all over the globe are being lit up purple that evening in remembrance of the folks that we have lost to overdose. So we have planned an event at the Adorney Center at the Sacco Amphitheater, 3 p.m. to 7 p.m. We have the mayor is going to give her mayoral proclamation of the day. There's going to be grief and mental health support and resources there. There's going to be folks who have actually lost folks to overdose and folks who have experienced overdose personally, speaking about their experiences. There's going to be also the band that played yesterday has agreed to be there. They're wonderful. So they were playing, for those of you that I guess it's like a bluegrass, jazzy type band, very, very mellow music. It really set the tone yesterday, and we were happy that they were like playing in the background. So they agreed and they wanted to be a part of it. So absolutely. We meet every Tuesday at 6:30 at Redwood Recovery Center. And some folks have requested that we provide Zoom access. So Zoom access will be provided at the next meeting. We didn't meet this Tuesday because we all had to prepare for the block party yesterday. So we will be resuming meeting next Tuesday at 6:30. There's also going to be a walk from the Adorning Center. It's a walk and vigil to Old Town. And we are also going to be partnering. Usually Hatcher and AHA usually do something, but they have partnered with us. So we are all going to do something collaboratively. And if anybody wants to have a table there or be involved, you can let myself or Jeanette know. We'd love to have you. The more the merrier. You know, it's crazy that we have to be excited about something like this, but you know, overdose awareness and education and SUD is my specialty. So you know, I really want to get this. We really want this to happen every year. You know, it's something that, you know, we have really high numbers. We see about 20 to 25 folks a month that come in for our emergency department experiencing overdose. So, and we certainly you know, have this yeah. So anyway, that's all for me. Thank you.
Thank you. Alrighty. Anything else? Our big presentation of the day. I'm so excited. Children's Behavioral Health Services.
Is it okay if I stay seated, or do you guys want me up there?
I think
I was like, we're doing this very round table thing. It feels very nice.
yeah, as long as you project so everyone can hear, I think you're fine there.
Okay.
Haley Emery is the Deputy Director of Children's Behavioral Health. Thank you so much for being here. Take it away.
Thank you, everyone. I actually have presented to you all a couple of times before in my previous role in QI, so it's kind of fun to be here in this new context. I think I just hit my 3-month mark, so bear with me. Some of the details or questions you might have, I might need to bring back. But just like a little bit about me before I dive into our programs and services. I started my work in the children's realm for behavioral health. So when I was a fresh intern out of college, I started at Remy Vista, which is actually one of our local org providers. And I saw kids there. I'm a licensed marriage and family therapist. I always had intention to impact kids. And actually, I've been telling people that as I've made my way into this new role, I feel like I've kind of come back home a little bit to what I really care about. So I'm excited to be a part of this team and part of the administrative team for behavioral health, and excited to share with you some of the details of our program and services. And yeah, with that said, I guess I do my own clicking, so I'll go through. So just to kind of give a little bit of context to sort of the way that we fit within DHHS, we have Connie Beck, who's here, who oversees all of the Department of Health and Human Services. And we've really conceptualized children and family services as an integrated system of care for youth, and that includes public health nursing, children's behavioral health, and child welfare services. And for some of you, you probably already know, but we're actually housed children's behavioral health alongside child welfare services over at the Plaza building near where the DMV sounds like it might be heading. And that's really, I think, a very supportive thing for us in helping to meet mutual clients' needs and to team together where we can. And we also have a really specific integrated program where we have, I'll talk about it a little bit more in this presentation, but I think integration across systems within DHHS is what makes us really successful in meeting kids' needs. So I just wanted to spend time reminding you all of our vision and intention. So our vision is that we are committed to engaging in relationships that are authentic, caring, respectful, and inclusive so as to be responsive to the needs of the staff and community we serve. That certainly is a strong statement that we stand behind in children's behavioral health. Not only is it how we interact with each other as staff, but how we interact with our youth and families that we work with. And I think embedded in that, I think we actually describe it more in intention, is also our attention to racial equity work as a system, and working to dismantle racism. It's a really crucial part of doing a good job in serving youth and families, and we are a system, so we've got to kind of pay attention to the policies we have in place and how we provide services. The Humboldt practice model, I'm not sure when you all last had maybe a presentation about children's behavioral health. The practice model was built within CWS, and then was taken on, from my understanding, by Children's Behavioral Health as well. We've done some work to kind of roll it out because it's so overarching and kind of hits on how we function as behavioral health as a whole. But Children's really has taken this on as a model of practice for ourselves. There's a lot of elements here, and I won't go too deeply into each of them, but I think the main overarching terms along the top in purple are kind of like really important elements. So we work to lean in, lift up, connect, and always have culture as part of the work that we do. A lot of this has to do with empowering families, empowering youth that we work with. It's not only how we interact with our clients and the people we serve, but also each other. I'm happy to dive a little more deeply if you all have questions about this model, but if not,
I have one question.
Yeah.
I was talking with Eric on our way over. I know about TAY and how that kind of fits in, but if a youth is having mental health services and it's discovered, and they're between the age of 11 and 15, let's say, and it's discovered that they're either experimenting or using substances, what kind of services do you try to do or roll out for such a kid? I know there aren't specific programs for that age, but I just wondered how it was dealt with.
Yeah, I think Deanna will be able to speak to the adolescent treatment program that we have the next time we have a meeting, and so she may be able to touch on that a little bit more. But what I can say is that behavioral health services can include working with those types of diagnoses as well. And I feel that with the CalAIM rollouts that I think you all have been privy to throughout the last couple of years, have kind of expanded how folks can access services. So there's no wrong door, and that includes SUD. So I think that we used to be kind of functioning in a system where it was like, SUD's over here, adults is over here, children's is over here. Our partnership health plan, who provides the managed care plan services, is over here. But really it's that people can sort of enter any system and then find their way to the right place. And what I really appreciated about that is that I feel that youth can, or adults, that maybe have substance use issues, but aren't quite ready to do a substance use focused program, they can sort of still remain within the mental health focused specialty mental health program until they're ready to move to that and kind of work on some of the underlying traumas or the elements related. There used to be rules in place that really didn't allow us to do that, because we wouldn't be able to bill for a primary SUD diagnosis. And so I think that shift has sort of opened things up a bit, and there are services available. I will also say that we do a lot of coordinated efforts with HCOE, and they are lifting up this SUD focus. I feel like it's an area we're probably gonna start thinking about even more, because fentanyl use or other SUD issues is on the rise, especially for youth as well.
You know, some of the statistics are showing that it used to be that, first use was like 14. And now a lot of times first use is like 11.
Yeah. Thank you for your question. So just to give some context, and this may be things that you already know, but we are part of the mental health plan, which is what also behavioral health is, and we provide specialty mental health services. And then that sort of can be seen beside partnership health plan, which is our managed care plan, where we're both in contractual relationship with DHCS, Department of Healthcare Services, to provide particular mental health services. And I will probably later on explain a little bit about how we transition between those systems, but just wanted to provide a little context. And for those of you who remember the term Beacon, Beacon is now Carillon, and that's the agency that helps to manage partnerships, non-specialty mental health services. And that makes Laura want to play. I did want to mention that we have an array of community providers in this area, some of which that are contracted with Carillon and provide non-specialty through Carillon, and some of which who are our contracted organizational providers, and some of those do both. So the list of contracted providers for all of behavioral health that meet that org provider level, most of them focus on youth and children, so they sort of fall in our area. And let me see if I can name them all, but we have Two Feathers, we have Sorrel Leaf, which is working to become a crisis residential for children, but right now they're providing mobile response services. We have Remy Vista, Changing Tides, and Humboldt Family Service Center, which actually historically I was on the board for them as well when I was working in school. They have my heart. Did I miss anyone? I think that's everyone.
What about United Indian Health?
We do a lot of partnering with United Indian Health. They aren't an organizational provider to us at this point. There's definitely a lot of overlap. And that is something I'm wanting to know more about, kind of the services that United Indian Health provides and what we provide, and where there might be room for further exploration of that relationship. But we definitely partner a lot with UIHS. I've gone to the table there plenty of times, especially around suicide prevention efforts and things like that. Yeah.
Can you help me understand the kind of non-specialty versus specialty, like what would fall in that each bucket?
Yeah, so specialty mental health, the criteria used to be a little more simple, and it actually expanded with CalAIM just a year or two ago. And for youth, it's a little bit more inclusive than it is for adults. So specialty mental health services are services for folks who have usually like difficulty functioning in life in certain areas, significantly due to mental health issues or mental health diagnosis. For youth, we actually use a tool, well, actually for youth and adults, we use a tool to screen people in to our services, and also the similar tool to sort of decide when folks are ready to transition out. And that is pretty much the criteria. And so for youth, what's expanded in the most recent years was that we've also included if you're justice involved, if you're child welfare involved, or experiencing houselessness, that sort of automatically puts you in the specialty mental health realm, whereas it used to be a little less clear with those specifics. So we have seen an uptick in referrals because that has opened. Yeah.
Oh, lots of questions, sorry.
That's okay.
Because you said some words that I'm like, what? Extended child services. what is the age bracket in that?
Do you mean like extended foster care? Is that what you're asking?
Mhm.
I don't know the specific. Connie, do you know the age range for that? Cause
Yeah,
I.
it's 18 to 25, I think.
Okay.
16.
Do you guys,
Yeah.
does do you guys work with them? And,
Yeah.
and if they're justice involved, how do I get a referral? Cause, well, I'll probably talk to you
Okay.
individually about
Yeah.
that. I'm like, really? And, no, cause I have like I'm just gonna say it, worked with a gentleman for, who was CWS involved, and then he hit the age where, he's no longer CWS, and so, like, he had no services. And so I'm trying to figure out,
Yeah.
what do we do now? So anyways, yeah,
So,
and he's justice involved, so
okay.
that makes sense to me now.
Yeah.
One of the things that happens is it's voluntary, and so if he doesn't choose to stay in extended foster care, then
They told me that
Then
there
he's
wasn't
just
enough
not.
people, there wasn't enough beds for him.
I don't know what that even means.
Maybe we can talk
Yeah.
more offhand
Yeah.
about that specific
Yeah.
referral, and I can help you
Thank you.
navigate, like, how we can best
Thank
support
you.
that person. I think that what you're speaking to is that we have a unique population that like 16 to 26, which is our TAY population, that sort of like falls in that, they're not quite young children, and they're also not, you
I
know,
think
they're
you said
entering
21.
adulthood. Okay, well, TAY serves 16 to 26, and that program is integrated with CWS and includes folks who have the extended foster care and are receiving ILS, but it also houses our TAY behavioral health program, which is sort of a directed program at that age range with some specific kind of criteria. And then we also have HCTC there, which also does great things with that population. So actually this week is Wellness Week for HCTC, which is our Humboldt County Transition Age Youth Collaborative, which is a group that I oversee as well, that includes youth organizers and then also our peers who are youth themselves, helping to support folks who meet that age range. So they're doing a bunch of workshops and super cool stuff this week. They did a Mattakit ride. And so far so good. I'm hearing it's going.
They were canning pickles yesterday.
Yes. Yeah, and they're doing like one where they're gonna mend clothing and so learn how to kind of sew and mend up clothing. Very cool stuff. Yeah. All right. Oh,
sorry for
I just did something I wasn't supposed to. Okay, there we go. We can probably brush over this quickly, but I just wanted to explain that our services reach across Humboldt County. Particularly, we have sites in Fortuna and McKinleyville, and then get folks out to East County and Hoopa areas. Our organizational providers and ourselves do a pretty good job of meeting the need across our very wide geographic area. We're pretty rural and we're pretty big, so we do a lot of regionally based services as well. I wanted to just give you all a moment to see some of the specialized training that we have in our team. Some of these may not be active right at the moment, but they are things that we've lifted up and may lift up again. One thing I will mention is that when we train staff on specialties such as this list, sometimes they go on and do other things and then they're no longer in our agency, unfortunately. But I will say that there's an increased expectation sort of coming down the pike from DHCS around use of EBPs, which I think is a great thing. Evidence-based practices are kind of a growing trend. I think it's always been the case that clinical staff keep themselves abreast to specialized training and may integrate it into the work that they do, but you know, we have various EBPs where we do them to fidelity, which involves a lot of extra work to kind of ensure that folks are properly trained, implementing it exactly how the program is supposed to run. And then there's always some reporting components to that as well. So just to share a few, I think the most recent up and coming one for folks has been EMDR, which is eye movement desensitization and reprocessing, which is like a very, very great EVP that a lot of clinicians are using right now. I think there's just kind of a shift in how we treat behavioral health that's moving towards some more sensation focused work. And then I just wanted to mention that we use art aggression replacement training as our structure for groups that we hold within the Juvenile Hall and New Horizons program. TIP is a really great one that actually was kind of voted on by our youth advocacy board, which is part of HCTC I spoke to briefly. That's a board of youth that kind of fit that TAY 16 to 26 age range. They lifted up their support in this particular EVP. And so our TAY behavioral health team is doing a great job working to implement that to its fidelity. But those are the ones I wanted to like call out the most. I'll move forward. I just wanted to also mention there are EVPs that focus on the younger population. I have a particular interest in the younger population, maybe because my kids are 1 and 3, but I also think that it's very much upstream and kind of a preventative way to help people is to help kiddos when they're young. And we have one clinician in particular who is just like the early childhood superstar of our team. And she's trained in CPP, which is child parent psychotherapy. She's also getting a certification that's kind of like PCIT, parent child interaction therapy light. It's called PC Care, I think. And then we've got TheraPlay. So I just wanted to kind of mention to you all that we've got some systems in place to make sure that our clinicians are really trained up and doing amazing work. This is sort of just a picture of the programs and how they relate to children's behavioral health. I will say that one of our programs is kind of missing from this. I need to add a bubble. But we've got our outpatient clinic. We have a focused group that works with child welfare involved youth. So that's our CWS or CWBH, Child Welfare Behavioral Health team. They're co-located with our outpatient clinic, so they do very similar work, but they just focus on the child welfare involved youth population. We have a team of case managers and parent partners. Parent partners are sort of like the peer idea where people are bringing their lived experience, but their parent partners are bringing their lived experience as parents to support families as they receive services from Children's Behavioral Health. I think it's like a very unique and really neat way to get at the needs of our families. We also have a substance use program that's focused on the younger population, the adolescent treatment program I mentioned earlier, but I'll let Deanna go into that more because she oversees that program. We also have folks who are housed over working with Juvenile Hall youth, and New Horizons program is for youth who have exited Juvenile Hall and received some ongoing services. We have a team that focuses on that. And then we've talked a lot about TAY. The missing bubble is our Humboldt Bridges to Wellness, which used to be Humboldt Bridges to Success program. That was a grant funded program that we lifted up for 4 or 5 years. It was when I was rather new in QI. It might have been like 6 years ago. And we were able to put clinicians regionally throughout the school district, throughout the county. So we had like East County, North County, South. We had folks positioned across the county to provide crisis services. That grant did end just this last fiscal year. And we are working to collaborate with HCOE to continue services in a similar way. We still have a sustainability coordinator at HCOE that's funded, and they have some folks that they're working to hire that will help support ongoing efforts to have a program like that continue. And so just to quickly share like some of the services that are provided within each of these. I can go through this quickly because most all folks, whether they're receiving services from our regular outpatient clinic or at TAY, have kind of the same array of services provided. So we provide individual and family therapy. We do have a mobile response team that's focused on youth. It's a small team, and we have, I would say the rock stars of the team are case managers. We've got case manager team that does a lot of follow-up in the hospital to help assist with creating safety plans if a 5150 is not upheld for a youth and the youth doesn't go on to be hospitalized. And they quickly create a child and family team meeting thereafter and work to kind of wrap around the child and family services after a crisis. We've got case management. We have an array of intensive services for youth. We have ICC, which is intensive care coordination, IHBS, which is in-home behavioral services, TBS, which is therapeutic behavioral services, and then CFT meetings, child and family team meetings. I started as a TBS worker as my very first job, and that was like very like in vivo work. You're with the kid and the families in their home or in the school, and you're working on very specific behavioral elements or supports that the caregivers may benefit from learning about. Those are kind of more intensive services, so folks may rise to the level of needing that if they have an increase in symptoms or maybe close to losing placement or just kind of showing kind of a higher need. We have medication support, so we have doctors that are dedicated to the children's specific area. We have 2, they're great. And we have a really nice nursing team as well. And then we have our parent partners. So like I said, outpatient clinic and child welfare behavioral health are co-located at our 6th Street office. And we are co-located with CWS. So I do a ton of work with child welfare leadership to team on things that we can work on together. There's a lot of processes that we both have in place that interact with one another. And so there's a lot of collaboration and teaming that happens, and us kind of living together in the same place is very helpful for that. I think that's kind of that integrated model that was in kind of a vision long ago for our agency, and it's something that really works. I think I've already spoken enough about kind of what case management and parent partners look like, but please let me know if you have questions. I'm gonna let Deanna speak more to the substance use stuff. I've kind of touched on most of this, so we probably can kind of skip through it. Just so you know, when I talked about the Humboldt Bridges program, it's very focused on kind of a shorter term. It's kind of a crisis is happening, the school's aware of the need, the clinicians are nearby because they're regionally based. They go in, kind of respond, maybe hang on to the clients for a little bit, but it ends up maybe being more of a referral mechanism for our outpatient clinic for more ongoing work. But I think that we've seen an impact on like crises that maybe could have gotten worse because we're able to get in there in the moment when the school's identified the need a little bit upstream. We've talked a lot about pay and HCTC. I guess I maybe will just open it up. I did want to show you this because it's kind of nice to see. It's almost like there's 3 branches within TAY. There's the behavioral health group, which is clinicians, the supervising clinician and case managers. And then ILS and EFC is the extended foster care. That's the group that's CWS, their house there as well. And then we've got HCTC peer coaching, which that program has an emphasis on helping youth kind of learn leadership skills, advocacy on kind of a more global level, like maybe making impacts around policy, but also self-advocacy. How do you advocate for yourself at your doctor's appointment? How do you lift things up for yourself? It's a pretty cool program. This is just another way of sort of seeing it. and the various services that happen at that site. I just wanted to touch on just a few things that are upcoming. We're bringing on board a telehealth clinician this next month. So they're a contracted provider and they're gonna take on a full caseload for us. We're really looking forward to that. Just wanted to highlight that teleworking is something that continues for our team, and it's really supportive to, I think, both clinicians and case managers and folks who work for us, but also for youth to access services. I will note, younger kids don't do as well with telehealth, and we're aware of that. And so it's not the only option. There are people who kind of focus on providing services in all the various ways, in the field, in the office, and telehealth where appropriate. But I'm glad that we have that option because I think it just expands our ability to provide the services. As you know, I think Emmy spoke to this last time we met, but we recently onboarded Smart Care, which is our new electronic health record, and there are some challenges with that. And we're working to just get better training and better reports. I think our team in Children's has done a really great job lifting up the creation of trainings where needed. I have a couple supervisors that are just rock stars and just kind of were like, this is a need, I'm gonna figure it out, and we're gonna team it together. I think we talked about the CalAIM screening and kind of expanded criteria, so I won't go into that. We are kind of feeling the effects or working through this update and payment reform, which Emmy has spoken to this group about as well, which we're functioning under a totally different payment system. And so that's new for us, and we're learning a lot, and there's training needs that come up with that as well. We get some block grant, mental health block grant dollars for our first episode psychosis program, which is embedded in our TAE program. And we're working with EpiCal, which I think is kind of associated with UC Davis, and they train to this particular EVP for working with folks who have their first episode of psychosis, which can happen along an array that even may expand beyond 26 years of age. And so this program is focused on young people that may experience their first episode. And the program that we're working to implement, I'm very excited about because it's kind of a team approach where the psychiatrist is positioned as a team member, clinician, case managers. We even include vocational assistance and support with education and job training, and kind of wrap all of those things around the person experiencing that. So we're working with technical assistance to bring that on. We also have a grant that we received from the Department of Public Health, and it's a youth suicide reporting and crisis response pilot program. And we're getting TA from an organization tied to this project. And it's helping to fund our children's mobile response team. But one thing I wanted to share with this group is that we had this awesome collaborative meeting back in May where we discussed, we actually mapped the full systems map of our current crisis response. Like if someone has suicidal ideation, what do we do? If someone dies by suicide, how do we respond to the community's need? I will say it felt like a little bit of a celebration because it felt like we were really doing a good job. We have some systems in place that other counties don't, like our children's mobile response team. Not all counties have something like that. And I think we're doing a really great job in responding to the needs in that way. And then the Bridges program is another kind of crisis-focused response that we have. So we did identify some gaps, and we're gonna probably reconvene in the fall and identify more gaps and include a larger group for that discussion. But that was community partners, internal partners, and it was a really good discussion. I just wanted to mention that we have an ILT meeting that occurs monthly. It's our interleadership. I can't ever remember.
Interagency
leadership team, and we're currently right now working with that group. It's really focused on how we serve youth and children, and we collaborate with a lot of folks on that meeting. There's tribal representation, there's HCOE and school representation, public health, everyone's kind of coming to the table around how we serve youth. And I think we're at this point trying to kind of identify some consultation around how to kind of move that team forward. And then we're working with Sorrel Leaf. They are set to hopefully break ground on their construction, maybe early September. And so we're really hopeful that they're gonna get up and running a children's crisis residential, which I mean, really the type of facility that they're doing is kind of the first of its kind. I think there's maybe 2 other counties that are lifting this type of facility up. And so we're learning together and doing a lot of partnering around bringing this on, and we're really excited about what impact it might have, especially because when we have youth that go to the ED because they are in a crisis, if they need to be hospitalized, they're sent out of county. We don't have a hospital here to serve youth. And having a step down, like a crisis facility, just like we've spent, I think, a lot of time in this meeting talking about for adults, the benefit of that for youth will be really, I think, great. I'm really looking forward to that. I think that's all my talking, and I know you guys covered in questions, but happy to hear more.
I'm excited that you came in and introduced yourself and the new vision that I have,
yeah.
because a lot of things, like I love to know the process of things so that when I'm helping somebody, I'm not like, I don't know. And people aren't saying, you know, when you're calling them, they're like, nope, this isn't the place, there's another number, and you're calling 10 different places. So it's great to hear your vision and the help that your team is able to share. Thank you.
Do you have that, what you just did for us as a handout that we can have, or?
Joe, do you think you could distribute the PowerPoint maybe to the team?
That would be great.
It was a lot to keep.
I know, I was like, ooh, I'm really saying a lot here. Yeah.
They need to be sent up.
Yeah.
Thank you. Our youth need us.
The question I get a lot from people is in the community around both adult and youth behavioral health services is how to navigate it if they are private pay insurance individuals. So I think that's the part that I always have a hard time with. And I think it's just an ongoing challenge for people, but how would you recommend I respond to that?
I think that it is a good reminder to know that we are a mental health plan, so we're obligated to serve the Medi-Cal population, meeting the specialty mental health criteria, though there are times where we do provide supports if it is a private pay situation. It's less often, and I know that this community does have kind of a dire need around that, and that every one of my friends, and I'm sure others can relate, if you're looking for a therapist in this community, it's very hard. Everybody's kind of booked and hard to get in with, but I think that, you know, private pay and then like private insurances, there probably are other places to access services, though there are circumstances where we can try to figure something out. I don't know if you have anything to add to that.
I was only thinking that the good part of private insurance is we can actually get folks to good placement that needs to happen. If it's a high level a case, it's easier to get good placement for them and treated for longer periods of time when we have a difficulty doing that with our Medi-Cal population.
True, yeah, but for the not like so severe needs,
it's really hard.
Yeah.
Yeah,
It's really hard.
There is a North Coast,
Oh,
North
yeah,
American
I
Mental
always.
yeah, there's a North
And
Coast
camp, yeah.
a Therapists Association. I've gone to a couple of their meetings. I stopped going because I'm not in private practice anymore myself and everybody else is there. But I was struck by how many people in that organization take substance use clients. And then it was really a wide range of people. What's the name of
It's
that?
in
North
camp.
Ed Camp.
Association of Mental Health Professionals.
Yeah, and the meetings I went to, there were like 50 providers. I mean, there were
There's
a
a
lot
big
of
list.
providers.
It also has a very searchable function on their website where you can type in payer source or symptoms or specialties. I send people that all the time and for my personal life because it's super helpful. Yeah.
Also, North American Mental Health, I just did a tour. We just did that, walkthrough recently. They have, children's services for therapy as well.
And they're
And they take
contracted.
private.
Yeah, they take private also. That's good to know and probably private pay too. Yeah. Because they're also contracted with partnership as a care log provider for non-specialty mental health, just to kind of position that.
They have a cool little child care therapy.
Oh,
Yeah.
cool.
Open Doors also, pretty robust with the mental services out there for people with private pay insurance. So I don't know if everyone thinks to go to their provider first and talk about it.
Yeah.
But when you do, you can get pretty good services through them.
That's a good point. Yeah, yeah. And for people that don't have a primary care provider, but have private pay insurance, which is a fair number of people who reach out to me. I mean, these are the folks that are oddly enough falling through the cracks here. Well, it's not, I'm talking to the right room where they're not surprised, but the people themselves are surprised that they're like, I have great insurance. What's the deal? I would say that's like the category of folks who reach out to me most, who are like, where can I turn? I don't know. I'm gonna go to my elected official, I guess. And, you know, I don't have great things to tell them. Yeah.
Food for thought, and I know I'm going somewhere else really, but, I know that, cause, you know, for, people, whether you have insurance or Medi-Cal or whatever, you have to get the referral from the private care. And right now, Fortuna Medical has openings for a private care doctor, that, is able to do, just saying, like, you know, they have opening. It's hard to get in to get a doctor care, so, they have some openings right now. And I've had good luck recently getting a few of my people in.
Okay. Yeah, I directed someone to them after hearing that, and they had said that they were putting them on a list. So that may be like a changing, yeah, I don't know, because I had just heard that a few weeks ago, and then I told someone that, and they were like, oh, they got put on the list, and hopefully it's a short list. Same with Soham Health and Redwoods Rural, but anyway, I kind of try to maintain like a running knowledge of that, because people do, and it's like, you know, I'm sure you know, it's like the weirdest thing to give referrals about. You're like, I'm not the expert, but, anyway.
They turn to you,
so.
yeah.
They turn to you, so you try to help them, yeah. And it's just, it's primarily not medical.
Right.
Debbie, did you have something? Just a quick thing, and I don't know enough about this, but as an option, I have an extended family member, a teenager, who gets therapy virtually. And I know nothing about how that came to happen. I could find out. Because, I mean, there's a lot of stuff out there, and you don't just want to click on anything that says therapist, you know, whatever. So, but apparently it's really been helpful for this young person, my granddaughter. So that's, yeah. So anyway, I think this makes me think I should ask more about how that works. If we're so isolated here, and we do have a shortage of medical providers.
And people who are licensed in California can treat anyone through California, so, that are living in California, so we don't have to be in the same county to provide the service, so. Yeah, there's some good websites, like I know Rula is good, and, there are others that are good one choices.
Well, maybe it's a future topic to invite the comp or whatever their name is, to share about how they take referrals and, you know, in case any of us get questions from people who are, you know, private pay clients that aren't really, like, the county's not the right mechanism for them, but that would be helpful.
Does anyone else have questions? Thank you.
Thank you so much.
Thank you.
Yeah.
You were
I think
awesome.
sending this out will help.
Yeah,
Me,
with
like,
the,
oh, I remember I heard about that.
yes, totally. Thanks for making space for
I
me
really love
today.
these glasses too.
Oh,
I like
okay.
these glasses. I just all the whole time.
I'm carrying on the cheetah print from my grandmother, so I have to always represent. Thank you.
Seeing hands there, so. All right. We will now move on to reports. And I'm so happy to say, the DHH director here, yay.
I'm so happy I could make it. It looks like I might be representing adults.
Yes.
Behavioral health today. So, let's see. Our adult crisis residential facility is opening in August. We're very excited. Contractors will blend. They are also looking at an adult residential facility to purchase in the Cutton area, and we are very hopeful that that sale is going to go through. And I think that it won't take very much construction, or remodel, and so to make it licensed. And so we are hoping, I think they said maybe in October. And that would be a 16-bed facility. So just adding to our continuum of care, it's just been pretty wonderful for us to actually get some movement here between those two, and then Sorrel Leaf coming on too. It's just really great. I was reminded I got another presentation from Sorrel the beginning of the week, and it's interesting to see all they've done, and it's taken 5 years to get where they are. It's just like, it's incredible. And them having mobile crisis response and stuff is really helpful for us too. So looking forward to that though. And I'm glad that the eagles are done nesting, and so they can just move forward.
And they that they can do more construction than they thought, even while they're nesting, so that's good.
Yeah, it's really great. And then I can update on the navigation center. The lease had to be amended because there was some insurance glitch, and so we had to stop meeting until that lease went to the board for approval, or the amendment went to the board for approval. And so that's done. So we'll start meeting again with the architect around that planning. Once we get a timeline for construction, then we will start having community meetings around what that looks like and services that could be provided there at the navigation center. I think most of you probably know our consultant. She's working for, who's she working for right now? Uplift?
Yeah.
Hannah Ozanian, who used to, she was the director at Loaves and Fishes in Sacramento. She will be helping us with the navigation center programming, and just getting us connected to all of the services that could be provided there. And she's actually given us some really great ideas over the last year or so with what might happen there. In addition, we're gonna have housing.
So
there was a projected date long ago for when the navigation center would open. And
Well, I can't even say until I have a timeline from the architect of when they can actually start construction and all of that.
Okay.
I do know that they were going back to the city. I just talked with Miles last week that they are going back to the city to ask for a couple of revisions on what they were planning to do. So I don't know. As soon as we have a timeline, I'll be sharing it with everyone. I'm excited to get this far. It seems like we have starts and stops, and I just like us to just keep moving, and not be set back anymore. The other thing is, I'm not sure if you all saw that the RFA for the first Prop 1 round has come out. That's the request for application for funding. We are taking a look at it. It's very complicated, and it can't be used it has to be used for additional beds. It can't be used for existing beds. So we can't use it to, remodel Semper Virens in its location, and we can't use it for the additional funds that we need for the triage center at Mad River Hospital. So
creative.
yep, we're thinking about who to talk to and what else we need to do in order to apply. And the application's due in December, so it's pretty quick turnaround. That seems like a bit, but for us, that's just right around.
I think that's all. Does anyone have any questions for the director? No.
So Connie, can you use Prop 1 for any of those programs that were talked about that are newly gonna come on? No, that are not sore leaf, but I think you said.
The adult crisis and that, no.
No.
No, and we have another grant that will be paying for the placements that will go to those new facilities.
So it's almost like you have to do a new 16 beds somewhere in order to use the Prop 1 funding. But no buildings or people are inside right now.
That's correct.
Oh, I'm so
Yes.
sorry.
And I don't have all of the criteria or different types of facilities. Is Nancy still on there? She is. Nancy, do you want to note the different types of facilities? Because I do think you'd be interested that it can do beds for substance use disorder.
Oh.
Yeah, actually, more than half of the eligible facility types are specifically for substance use disorder. There's a handful for children and a handful for adults. Yeah, and they're very explicit in the request for applications. I'm happy to send that RFI out through Joe so that anyone who would like to can take a look at it.
Thank you, that would be great. Creative minds, I think. Thanks, Nancy.
Nancy.
Alrighty, thank you, Director. Emmy isn't here. AOT, Jack's not here. We know that's going away December. SUD committee update.
Well, my name is Danette and I'm apparently not fired yet. I'm the new chair, is that how you say it? I'm the chair for the SUD. And we had the person that took the notes isn't here, so I'm gonna wing it. There's some thoughts that I have, and I'm hoping that it doesn't conflict with anything else for the next 3 months. I'd like to next month have Carrie and Kathy come from Jared Phelps to introduce what the plan is for their program, and see what they're doing so far, from SoHum. And also possibly, the next month, maybe do Redwood Rural Health. Cause I know we've been talking a lot about how we don't have anything that's in this meeting, regarding SoHum. So, there's a lot of things, big things going on, a lot of planning for out there. And I know I have a lot of clients that are from out there that I haven't been able to like get connected, in a lot of ways. And, so I'd like to do August, Jared Phelps. What month are we, Dark?
August.
August, okay, so how about September?
So that's for your committee.
My committee, yeah, I'd like, them to come out and introduce themselves. I think it'd be great. So
Actually, no, at that committee meeting, we decided that SUD was gonna meet in August, since we're just
Okay.
getting some gaining ground.
But not this meeting.
Coming up in August.
But not the behavioral health meeting.
No,
We're not having a meeting in August.
right, behavioral health is not meeting, but the SUD committee is going to.
So does sorry, I have to ask these questions. So does the SUD come to this meeting? Because I know that there was some comments a while back that we don't really talk about the substance use part of mental health. And so
that's
to
what-
introduce.
Yeah, so the smaller committee meets, gets information, then comes to our board and shares that. And
Okay,
if you want to have somebody come and present, you can go to the executive committee. And we do have, Deanna is on tentatively, I think, October to present about SUD. Big, so, and we can talk about that more.
and are we only presenting county stuff, or, I don't understand. Deanna, you said Deanna's bringing SUD.
She is going to come to the behavioral health board meeting and do a presentation.
Okay,
Just sort of the same way that Katie.
okay.
did. In October, that's what we have.
And is it, okay,
So something that was clarified at this last SUD meeting that I wasn't clear about until somebody said it, is that the SUD DR committee's job in terms of the providers is that committee can go out and kind of look at the other providers of SUD services, county or otherwise, county or contracted, and bring back to the general behavioral health board any recommendations for gaps or a miss or whatever. When I was in Sacramento County, the behavioral health board did those visits, not the SUD committee, so.
well,
It's different here.
we are a member of the Behavioral Health Board, and this is a subcommittee that is actually doing substance abuse.
Right. And it's a required committee.
Correct.
Every behavioral health board.
Correct.
Also too, folks, hi, Raphael, sorry to interrupt. I did confirm with Laura yesterday, and Danette, I didn't get to tell you that I would accept the co-chair position. I did speak with leadership and my schedule, so yes, I am willing to commit. And then Danette, that would also relieve some pressure from you, and then we can also maybe get together and split up, things on our agenda. But I think, yeah, I think this is wonderful, and I would love to sit with you on this committee. So.
We're a great team. Thank you.
Oh, team Danafia Real. So, yeah, and I can talk with you more.
Yeah, sorry.
Clarification. All good.
Not fired yet?
No. No. Took too long to get you. So at this point, we have no other committees, but always putting it out there that we need to have the Children Behavioral Health Children and Families Subcommittee, we need to get that going. Whoever's listening, remember that. I'll be reaching out to someone, and then also the adult one. And I know that was near and dear to Tim Doty's heart, and maybe he'll be able to be freed up to work on that. As I look at Virginia. Chairman, Vice Chair, Tim isn't here. I guess all I want to say once again is the more I learn, the more I am impressed and grateful for our county and what we do. So I just will always say that. Good job. You're right. Like we have a lot of things that many counties don't have. So we need to remember to be grateful and lift that up. That's what I got. So an unfinished business, navigation center, we had an update on that. Care Court, I don't know if anybody wants to, I know we're gonna have a presentation on that in November. If there's any updates, Sharon, if you have anything.
Well, there aren't a whole lot of updates at this moment because we are still working through the process, speaking with our court partners, having monthly meetings, talking with them on how we're going to interact, how we're going to process these cases. And it's a huge lift. It is a huge lift for behavioral health to do some of this court work that we are not familiar with doing court work previously. But we're getting there, and everybody's at least in the room and talking. We will be bringing information, like you said, in a future presentation, which would be great because right now I would just be able to present you with all the questions that we have without very many answers. But work continues and we are getting there.
Awesome. Thank you. Appreciate you, Sharon. And with that, any future items?
I do have a question for you. I know what Care Court is, that other money that's coming through Prop 1, can it be dovetailed in with services for Care Court in order to facilitate an agency coming on board about doing some of that? It really drives me crazy when I think that we might lose a significant amount of money because we don't have a provider to do something.
Yeah, certainly. The Prop 1 money really is designed for Care Court. They really are pushing hard for the Care Court program to utilize Proposition 1 funding. So that's part of their intent. The state has made it incredibly difficult to do that, but that is the intent. But it can only be used to build facilities. The money we need for the services, of course, is always the problem with the building that you need to set up. Certainly, if we could get anything together and a developer that is interested in building in our community something that we can utilize specifically for the Care Court population, you know, that would be ideal, and we could look at utilizing some Prop 1 funds for that. But yeah, it's only for building itself. For the services itself that it requires, it doesn't touch it.
Right.
Natalie and then Danette.
I do think that provider network, some representative from it, if they're willing, would be great, that we talked about earlier. So we have a better idea of how to make that, bridge that gap with private pay. And then remains to be seen whether this will be like a topic that we would need or want a presentation about with the governor's new pronouncement about clearing encampments on state property is new today. I'd heard inklings of that it was coming, but there's a lot to unpack there and what that means and what that means for behavioral health.
Can you say a little bit more about that? Is that clearing property via police or sheriffs?
The governor gave direction to state agencies to do that on their property. So like Caltrans, for example, if they're encampments in their right of way. Actually, I don't know if it applies to right of way or just the property they own. Like if it's fee title, I just don't know. So yeah, I think I imagine all those agencies will need a little bit of time to figure out what their plan is, but they'll surely be working with DHHS on the list.
We talked a little bit about it this morning while I was emailing back and forth with someone and it's not that much different than what Caltrans has currently been doing, although they've been very selective because it's like they've really been focused on under bridges and stuff like that, right? Yeah, but there is more conversation to be had though around the decision itself. It's really the decision around grants passes. And I feel like our law enforcement is trained so well now, and knowing that just moving folks isn't the answer.
Right.
So I'm hopeful that more conversation that we'll have locally will help us.
Yeah, it just seems like it's not right for like to form an item around yet, but I think it's gonna continue to be ongoing.
Sharon, did you have something?
I just wanted to build on what Connie was saying, because she's absolutely right. What it looks like, reading through the executive order and all the whereases in there, is not a whole lot of actual practical effect on what is already going on. But it is a big press announcement, and it goes back to the Prop 1 money that is, they have the release out for. Because if you'll read in the announcements on the executive order, they're talking about how, the state has just given huge amounts, buckets full of money to all counties to build everything. And it's a lot of building into that Prop 1 money, but the actual impact on the street itself is not significant for what they're already doing. But it'll bring up conversations that we should be talking about, of course.
Yeah. Okay, put it on the list for future. Oh, did you have something for future presentation?
I did with, someone.
Okay.
Joe Phelps, sorry.
Okay. All right. Anything else from anyone? Oh, so proud. With that, I will adjourn this meeting at 13:49.
Woohoo!
1:49.
Yes.
Thank you.
Can I have dibs on that?
Got 10 minutes between
This
breaks.
one? Yeah, it's the first time I've been able to come in a long time. And it's natural.
10-minute break.
So long, I didn't actually get there.
I think it's already,
Thanks.
meeting that I've been watching.
Thank you so much.
Yeah.
Oh,